The World Federation of Haemophilia and the Canadian Hemophilia Society are excited to welcome the global bleeding disorders community to the WFH 2022 World Congress in Montreal. This hybrid event is one of the largest for the bleeding disorders community and will be covering the latest medical and multidisciplinary developments in the field, as well as hear from inspirational and insightful speakers from a variety of backgrounds and experiences. This is the WFH Congress Daily Recap. Welcome back for Tuesday at the WFH 2022 World Congress. We hope you've been enjoying all the live sessions so far. Today is our last show, but we have plenty of exciting content lined up for you again, so let's dive right in. On today's show, we get insights into the research and data collection efforts by WFH, including the annual Global Survey and Gene Therapy Registry. We'll take a look at the latest work from Oregon Health and Science University, as well as the Hemophilia and Thrombosis Center at the University of Colorado. First, though, the WFH work in close collaboration with a global network of national member organizations, or NMOs, to foster knowledge exchange and improve access to treatment and care for all people living with hemophilia around the world. So let's find out about the impact NMOs are having in their communities.
Well, I work in Civil Service Hospital. It is a public hospital located in Kathmandu, the capital city of Nepal. It is a tertiary care center for blood-related disorders. So we take care of all sorts of blood diseases, from benign blood disease to malignant blood disease. We are only a center to offer bone marrow transplant service in the country. WFH has impacted a lot. You know, in the past, we relied on WFH for all of our factor donations. Because, as you know, Nepal is a low-income country and we're not able to buy clotting factors because those were very expensive for us. So WFH is donating clotting factor for us since 1999, I think. And they have donated a huge number of clotting factors, and that has really helped our patient in many ways. Before, because of lack of clotting factors, most of our patients were physically disabled. They were not able to go to their work, go to school and do their usual stuffs. Now we have a clotting factors, and we have recently started prophylaxis treatment also. So most of the patients are doing well. I think it has impacted a lot because, in the past when the treatment was not available, the patients were not confident enough to come out and to talk about hemophilia and to advocate for it and to talk with the government saying that, well, we need help from you guys, But with WFH, they have helped in implementing or initiating various advocacy tools, and which has really empowered patients to come outside and to come and to talk to the government and to talk to the concerned authorities saying that, look, we were neglected in the past, now we know our rights, we should get equal access to the treatment and things like that, which has really changed the whole society. As a physician, it makes me feel very good. As a citizen of a country, that I feel very proud now to say, well, because of the availability of the treatment, all the patients, they have really started enjoying their life. When we started the Nepal Hemophilia Society in the past, we were not united, the hemophilic patient, because Nepal is a small country and we speak 123 different languages, various ethnic groups, and it was very difficult for us to, to bring them together. Those are the challenges you will meet in every country, and I think the NMOs should represent each and every patient, not only the single province or single cities or single things like that. So I think one should have that capacity, one should have that leadership to represent the whole community as a whole. This is what we need now in NMO all over the country.
I am joined now by Professor Alfonso Iorio. He is the past chair of the WFH Data and Demographics Committee. Thank you for sitting down with me today.
Thank you for inviting me.
The WFH has been collecting data now for over 20 years, quite a long time. So how is that data now being used by the community?
So it has been used essentially for advocacy. It has been used to make hemophilia known to local health authorities. It has been used also to create culture. It has been a way of comparing countries with similar countries or with luckier countries, wealthier countries. It has been used to share knowledge about how to best treat hemophilia. It has also been used for science. You're right, it's over 20 years. When the AGS was 20, it created robust evidence that was used to make research possible, to lobby for investment in hemophilia research and pushing the science forward.
It must be so satisfying to see all this come to fruition finally.
Absolutely, it's true fun.
Well, I'm glad you're sitting down with us to talk about it. I want to talk to you also about the status of von Willebrand disease and the data collection around that.
So the WBDR is steered by a group, and that group decided to create a subgroup fully dedicated to identify the best way of collecting data for von Willebrand disease. And there's plan to launch a module, a dedicated module later in the fall, first with WBDR and then with my WBDR, to try and standardize the way data are collected for VWD. We know it's important, we know it's a very bloody disease, quite common, very variable. We plan to help. It's a tough job.
Wow. Well, keep up the good work. Thank you for sitting down with me today.
My pleasure.
Thanks, Professor.
Thank you for having me here.
The WFH Congress Daily Recap features highlights and interviews from this year's WFH World Congress in Montreal. You can find us around the Convention Center, on the WFH Congress platform, and online. There's plenty more to come, so make sure you keep watching. Stand by for more on the Gene Therapy Registry coming up with Dr. Barbara Konkle. But first, let's head to Oregon Health and Science University, where they've created specific clinics for women and girls with bleeding disorders. Patients can see gynecologists and hematologists at the same time to provide better coordinated care.
Here at the Center for Women's Health, in partnership with the Hemophilia Center at Oregon Health and Science University, we're focused on managing heavy menstrual bleeding in women and girls, both with bleeding disorders or with other kinds of disorders like clotting disorders.
When women and girls do make it to our clinic, it can be really impactful because they've kind of realized their whole life that their bleeding is similar to moms and aunts and sisters, and not know that that's not normal. And so it can be empowering to recognize that, oh, there is something in addition going on and we might be able to address it.
And I think just normalizing that conversation is so important for these patients, and then allowing them to open up the conversation. Research has shown that a lot of patients are afraid to talk to their doctors about their periods, and so if we just even start the conversation, that's a big deal.
In the second of our features, we visit the University of Colorado Hemophilia and Thrombosis Center. It brings together diverse researchers specializing in biomechanics, cellular regeneration, bleeding disorder pain, women with bleeding disorders, and much more. Together, they provide comprehensive treatment and diagnosis of bleeding disorders in patients of all ages.
Our investigators are all united in their passion for ultimate good patient outcomes and a sense of wellness, but our focus is very broad.
In our lab, we use patient samples to understand abnormalities, but then we try to study those abnormalities, maybe find ways that we can modify it or change it, or alter some of those properties, and then potentially kind of expand it back into a patient.
So we're working on technologies currently to use these inertial measurement unit to monitor how people move wherever they are.
You can come to our clinic and see the same doctors throughout your lifespan and get the same access to our comprehensive services.
We use science to guide us as we push the limits on what persons with hemophilia can do. Our focus has expanded to platelet and von Willebrand disorders, women's bleeding, adult pain and activity, thrombosis and stroke, with the same enthusiasm for improved patient outcomes.
Joining me now is the chair of the WFH Gene Therapy Registry Steering Committee, Dr. Barbara Konkle. Thank you so much for sitting down with me today.
Oh, it's my pleasure.
We're going to talk about the Gene Therapy Registry. So take us through it. What is it?
So the Gene Therapy Registry is a prospective registry with the aim of capturing data virtually on all people with hemophilia who receive gene therapy, either after it's approved and commercial, and also to capture individuals who've been on clinical trials.
Why is it important to capture long-term data?
So gene therapy is new. There are a lot of different areas where gene therapy is being applied, but it's really new for all those areas. And while the trials to date have been safe, and we have some understanding of efficacy and durability, we really need to follow individuals really over their lifespan after having received gene therapy. The primary goal of the registry is safety. And hemophilia is a rare disorder. Gene therapy will be given to initially a small number of those with hemophilia. And so we really can't capture safety data by looking at small groups. We need the largest group we can get.
Why is the WFH well positioned to lead this?
So the WFH is international. It has representation both from the scientific community, the provider community, the patient community, and industry. And so we can come together to have the right input to have a successful registry.
Why is it important that it's a global initiative?
Well, the global initiative is to capture as many patients as we can. And we see gene therapy as being applied globally. The clinical trials are more selective in terms of countries, but implementation, there are a lot of advantages for gene therapy once we show it's safe and effective for countries that have fewer resources. And so we really need to capture it so that the individuals who receive it are well represented, and so that we can look at efficacy and durability and safety in those individuals around the world.
Certainly important work. Thank you for sitting down and taking me through it.
My pleasure.
Have the best day.
Thank you.
Now let's head out to the exhibition hall to speak to some attendees and find out their highlights from the meeting. Let's go.
Oh, this has been great. I'm so glad that we're finally back to in-person meetings, because the WFH Congress is always one that I love to attend because the information is so good for everybody who attends. If you want to get the latest information on how to take care of your patients from the science that's out there, this is where you get that information. I'm hoping before I retire that we will have a cure for hemophilia.
So I'm here as a parent of a child with hemophilia. For parents, I think meeting other parents, meeting others across Canada who've been in similar situations or very different ones, and learning from them. In Saskatoon, we don't have a huge community, in all of Saskatchewan really. So it takes events like this for us to really be able to network with a bigger group of people. Every family with hemophilia is going to be different and come to the table with different experiences, and just kind of figuring out how to support them where they're at is probably the most helpful thing.
In like other disease areas, you don't really get kind of patient-driven groups and organizations that have this much effect and have this much like tangible contribution, I guess, to the disease area. Whereas, with the WFH, just to like even the Congress setting everyone up and being able to have these talks and see all these people together to better the treatment is ultimately what the purpose is, right? So I think that is what probably the best thing they're able to do is.
It kind of helps the attendees to develop their skill set and kind of get a better understanding of what's happening all over the world, and kind of get an opportunity to share ideas on what's happening in different parts of the world, and kind of get a better understanding, get a global understanding of how bleeding disorders is managed globally.
I think it's so important. You can spend your whole career working in your individual place and not know that other people are doing the same thing that you're doing, and maybe doing things that you could do better and learning new approaches and new perspectives. So I think it's really important.
I'm a graphic designer, I'm a photographer, I'm a videographer, I'm an editor as well. Your condition doesn't stop you from doing as much you would want to do and achieve in life. My name is Elliot Chintembo. I'm the current chair of the Zimbabwe Hemophilia Association. I'm a patient. I've been living with hemophilia for the past 39 years. For me, life has been a miracle. I live in a miracle anyway. I have so much faith. Just being here, WFH has done so many things for us. It's so many to mention, from the medication, the teaching resources, and just bringing us together with other communities. It's something that you can't do alone.
So great to hear from some of those who made it here to Montreal. Well, that's it from us here at the WFH 2022 World Congress. It's been a great meeting, and we really hope you enjoyed watching our shows. And of course, if you missed anything from us here, all the content will be available on our playlist on YouTube, including extended versions of interviews and features. So make sure you take a look. We look forward to seeing you in Kuala Lumpur, Malaysia in 2024. Goodbye for now.